And Chris will now present. Chris, the floor is yours.
No.
Yes, hello. Yes, you are on. We see very well.
Brilliant. Okay, so what I'm going to talk about today then is the work I've done into psychological theories of crowd behaviour. I'm probably what is known as the academic equivalent of an ambulance chaser, because I spend a lot of my time researching crowds and trying to undo a lot of the myths about them. And that's pretty much what I've been doing for most of my career. So I'll be covering that, the theories that guide our behaviour on why people behave in emergencies the way they do, but also practical examples of the implications this has for emergency planning and response, because I believe very passionately that the academic work myself and others in the field do should have practical applications for helping crowd management and crowd safety. And obviously the most current topical relevance I will cover will be the COVID pandemic, because psychologists and social psychologists have a lot to say about what's been going on in this pandemic, and I will explain that in a bit more detail what I mean. There's three main areas that psychologists have been commenting on recently, which was the phenomenon that was known as panic buying before we went into lockdown in the UK, and we've recently seen again, compliance with the restrictions during the lockdown, and what's going on during the second wave, and give you some examples of what psychologists would say were good leadership and bad leadership. So that's all the things I'll cover. Please do get in touch with me via my email details if we don't have time to cover things today, because the field is vast and I could talk about this for hours, but I've only got 20 minutes today. So, where does the study of crowd behaviour start then? I first started researching this area about 15 years ago. And what we found was that there was some very deeply held beliefs about how people behaved in emergencies that we called the panic model, which was the idea that in mass emergencies, people would panic. And I spent most of my career trying to undo the beliefs behind the panic model. The panic model comes very much from an irrationalist tradition of crowds, which considers that crowds cannot be trusted to behave rationally, and human beings are sensible, logical individuals on their own, but as soon as they enter into a crowd, there's something about being in a crowd that makes them irrational and no longer able of behaving sensibly. And most of my career has been spent trying to undo the panic model and show that it's just not supported by evidence. It's just not a good model. What it argues is that if you're in an emergency, you will become fearful. That in itself isn't that controversial, because life-threatening emergencies that have casualties and fatalities can cause great fear and distress in people. But what the panic model would also say is that this fear, this threat, causes your emotion to overwhelm your reason, that you are no longer able to make sensible choices because you are so fearful, you panic. This then means that your collective identity breaks down. You no longer care about anybody else apart from yourself, and you will behave selfishly. You will push people over to evacuate, and if anyone falls on the ground, you won't pick them up and you will trample over them. The facts of most studies of emergencies have found that this almost never happens, but it's still a very deeply held view amongst emergency planners. And a final premise of the panic model is that if one person starts behaving in a selfish or a panicked way, then other people will join in, and these behaviours will spread to the whole crowd very, very quickly in a concept called contagion, in an almost medical model that if one person gets a disease, everybody else will catch it. So there are implications with having a panic model. It's not just an academic exercise. If you believe that crowds will panic, that then means that you see crowds as a potential public order problem rather than a public safety problem. And that can have problems. And one of the main problems with this is that it then guides you down a more coercive way. So studies of CBRN responses, which is chemical, biological, radiological, nuclear, if you have a dirty bomb incident or you have a chemical weapons attack, until relatively recently, the models that were training the emergency services in the UK, the police, the army, were based very much on this coercive approach. But research done by colleagues at Public Health England at the University of Sussex have found that these coercive approaches to decontaminating people, if they've been contaminated at an incident and they need to stay in the area to be contaminated, coercive approaches are just counterproductive, because what you need is you need people to comply with instructions to stay in the area to be decontaminated. And if they're fearful, if they're distressed, they're less likely to comply, and they're more likely to want to be able to evacuate the area and leave in any way they can. Another implication of the panic model is that if you believe that crowds will panic if they're made aware of the threat, then you will withhold information from them. You will think, we can't tell them about the nature of the threat, because if we do, they'll panic. And a recent leak of a conversation that the journalist Bob Woodward had in the United States with President Trump, he allegedly referred to the reasons for him downplaying COVID-19 were because he didn't want to cause panic. Now, putting to one side whether or not you believe the truthfulness of that statement from Donald Trump, even if you do accept that it's true, I would say it's problematic, because it buys into the old tired panic model and assumes that if you make people aware of a threat, they will panic. And again, there's no evidence to support that. And a final implication of the panic model is you will then see the crowd as a problem rather than a potential resource to draw from. So you won't consider possible ways that they might be able to help you with your emergency response. And as we're seeing in the current COVID pandemic, we need mass compliance with lockdown restrictions, but you also need acts of mass cooperation. If people self-isolate, you're going to need other people to do their shopping for them. So if you don't consider that the public are able to help, if you assume that they won't be any use because they will panic in emergencies, you're actually denying the possibility of using what is a vast resource that might actually be for the public good. So those are implications of having a panic model, and that's why we're critical of the model. Okay, I'll just advance this. So what we've suggested instead from our research is what we call the social identity model of collective resilience, or the SIMCA for short. And what we've argued is that as an opposite to the panic model, disasters can actually create a common identity. So rather than collective identity breaking down, having a sense of shared threat that we're all in this together can actually bring people together. It can create psychological bonds that mean that people behave cooperatively and altruistically towards each other as they all try to respond to the common threat. So this then means that in emergencies, you're more likely to see cooperative behaviour rather than selfish behaviour. I'm not saying that you don't see any lack of cooperation or any selfish behaviour at all in emergencies, but if there is a lack of cooperation, it's usually due to factors such as people not being given sufficient information about the situation, the physical constraints of the situation. If they're so physically crushed together, they're not physically able to help. Or, and this is relevant to the COVID pandemic, and I'll come back to this, if you cast people psychologically in competition with each other, then they're less likely to behave cooperatively. And this theoretical model, the SIMCA, is supported by evidence from mass emergencies. A recent publication I produced with colleagues John Jury and other colleagues who work in this area offered practical recommendations for safe crowd management, how you can apply the SIMCA to ensuring that crowd incidents are safe. Okay, now, as with this model, particularly given what's going on at the moment, there are politics associated with the resilience model. I believe very strongly that crowds can and do behave resiliently in emergencies and the more general public, but there is a danger of it being used rhetorically and even for propaganda purposes by populist governments, because it's possible then for populist politicians to say, oh, well, people are resilient, so we don't need to provide raw resources to look after them after emergencies because they will just behave resiliently. I would be very, very critical of that view, because resilience doesn't mean that people's lives are not disrupted or distressed, and it should never be used as an excuse for not taking public protection seriously or even cutting post-disaster support. Because if you don't give the resources to people, if you don't give them the information and the training beforehand and the resources afterwards to behave resiliently, they won't be able to behave resiliently if they don't know what to do, if they haven't been trained. And it is also vital that communities have a shared sense of exposure to adversity, because if they don't, if people feel that they are being treated differently during an emergency and some people are not suffering as badly as others, the notion of we're all in it together will very quickly become empty rhetoric. And that's happened here in the UK, and I'll give some examples of that in a minute. So there are political considerations to be aware of when you are considering the concept of resilience. Okay, so I'll talk about the COVID pandemic now in the rest of the time I have left. Now, it's been widely recognised by psychologists in the UK that collective responses to the COVID pandemic have often been pathologised, and I'll give some examples of that. And I would say that's a real problem, because it is vital in this current epidemic that solidarity and cooperation is encouraged, and this is done best by appealing to people's shared identity and social norms and trusting in the public's ability to self-regulate. This is far better in encouraging collective compliance than a more enforcement message, a more coercive message. People are much more likely to listen to public health information messaging if it's done in a cooperative way rather than in a coercive way. Now, there's some aspects of the restrictions that obviously will become necessary and are necessary, such as social distancing. I prefer to call it physical distancing because you can be distanced from people physically but not socially. And psychologists say it's vital to keep this sense of psychological connection together to stop people feeling isolated, especially those members of the vulnerable population. So since lockdown, every family has been meeting family members by Zoom and having pub quizzes. I've done that in my family, and it's vital that people stay connected with each other if they can't stay in physical contact with them because of fear of transmission of COVID. Within the pandemic as well, it is vital that you have effective public messaging, and it's important that the public trust the information given. So it's not just the information itself. They need to trust the source. They need to believe and trust the people that are giving them that information. And if they do, they're much more likely to comply with any necessary restrictions that they might be asked to do. And a simple way to do that, I often get asked, well, how do you do that? I would say we need more we speak. When politicians and when health officials are talking to the public, they need to encourage more shared identity. So rather than saying you must do this, it should be we all need to do this, because that will then encourage people to think collectively and not think, how do I survive, but think more collectively of how do we all get through this. And this is particularly important with the COVID pandemic, because it seems to be that there's some groups of the population, say as the young and people without underlying health conditions and people who are more wealthy, are less likely to be susceptible to catching COVID and less likely to suffer bad symptoms. But the problem is that they may then infect other people who are much more vulnerable than them. So we do need a much more collective response. Okay, so what I'm going to talk about now is different psychological phenomena that we've seen in the UK, and I wouldn't be surprised if we've seen them further afield. So the first one is the concept known as panic buying. I prefer to not even use the term panic buying, and I often say to the media, stop reporting things as panic buying, because you actually create a self-fulfilling prophecy. In psychological terms, panic buying is a classic example of a social dilemma. And by that, what I mean is that what is in the individual's interest, which is to have sufficient food and sufficient stocks of toilet roll, etc., is not in the collective interest, because the resources and the capacity in the system do not have enough in the system to provide for everybody to stock up at the same time. The problem, though, of calling it panic buying, though, is it obscures understanding of such behaviour. It doesn't help you understand why do people do it, and if the media report it, there's a real danger of it becoming a self-fulfilling prophecy, because if people see television footage of people going out and stockpiling and buying lots of toilet roll and buying big bags of pasta, they will see that footage and they will then think, if I don't do that as well, I'm going to miss out. By the time I get there, all the shelves are going to be bare, so I better do that myself. And that often is the thing that actually causes the stocks to run dry. So what I would say is, to try and discourage that kind of behaviour, you need to encourage a more common identity and more cooperative social norms. So often the media say to me, well, what should we do? You can't censor us. And I would say it's not about censorship, because what you could present is the equally true message that there is enough for everybody if they just buy what you need. So the media could show footage of people just doing their normal shopping and not running out and filling up their trolleys. But unfortunately, that's not as newsworthy as people fighting over toilet roll. And I constantly say this to the media, that they do need to be a bit more responsible in what they're reporting. It's not about censorship. It's just about encouraging the correct social norms. And another good way of discouraging it was, in the UK, there was some footage that went viral of a nurse who'd just done a 13-hour night shift, went to do her shopping, and there was nothing left in the stores and she couldn't buy anything. And there's some footage on Twitter of her crying, saying to people, you've got to stop doing this. And that quickly went viral and was quite influential, hopefully, in discouraging other people to do it. Okay, so I'm going to talk now about different phases of what happened in lockdown. So the UK went into lockdown from the 23rd of March until the 10th of May, the first time round, until restrictions started to be eased. Now, the messaging at the start was fairly good and fairly consistent. When the Prime Minister Boris Johnson addressed the nation, I think it was on the 23rd of March, it was a very clear message. It was, you must stay at home, protect the NHS and save lives. And the advert that was produced by the NHS used a well-known British actor, Mark Strong, who usually plays the baddies in films, has quite a severe, dark voice. And it was argued that he was chosen because he had a much more authoritative voice, and it's a very noticeable, recognisable voice. And so I would say that's an example of a good advert to get people to comply. And the initial compliance rates in the UK during the first phase of lockdown, from the 23rd of March to the 10th of May, were much higher than expected by the authorities. The authorities did not expect compliance to be as high as it was. And it was mentioned in some press conferences that there was this concept of behavioural fatigue, that people might suddenly become fatigued about obeying with the lockdown. The problem myself and other people have with that is the concept of behavioural fatigue has no basis in social sciences at all. None of us had ever heard of it. And it's now fairly well accepted that the concept was made up on the hoof within a press conference, and it's not backed up by science. Okay, so more recently, the unity has fractured slightly, and it's now come into question whether we are all in it together. Since the 10th of May, restrictions were eased. The message became a bit more confused. Stay alert, control the virus, save lives. Lots of people, myself included, were saying, well, what does stay alert actually mean? And the different UK governments, in the devolved governments, had differing views to it. Most of them kept the original slogan, which is stay home. On top of that, the scandal of Dominic Cummings, Boris Johnson's main advisor, driving up to Durham when him and his wife had COVID symptoms, undermined public confidence, because people then started thinking, well, it's one rule for them and another rule for us. And compliance rates have suffered since then. And there are concerns even today about compliance rates because of the poor response that the UK government has had to the coronavirus. Okay, so I'll quickly talk now about mutual aid. I've got a couple more, so I'm mindful of time, so I will quickly go through these slides so I don't take time off the second speaker. Current research I'm doing looks at how people cooperated during lockdown, how people provided help for each other, and we had volunteering by hundreds of thousands of people, and it seemed to be that this shared identity did last for a long time. People did go on and they did continue supporting and helping each other. So the idea of behavioural fatigue doesn't seem to have been supported, that people do seem to cooperate in the medium to long term. And every single person I interviewed, when I said to them, would you do the same thing again if there was another lockdown, they all said yes, they would. So that's quite an encouraging message about kind of public support during emergencies. Okay, We need to build up trust, though, and this has been said by the scientists on SAGE, which is the special advisory group on the scientific advisory group on emergencies, which is populated by scientists, psychologists, behavioural modelers, epidemiologists who advise the government on the COVID response. And Susan Mickey, who's on the behavioural scientist panel that feeds into SAGE, has argued that it is vital for the public to have trust in the government. If they don't have trust in the government's message, then people are less likely to comply. And the problem is that there's been a catalogue of recent failings in the UK government with their response to the pandemic. And I've just seen on the news now that Boris Johnson was getting completely confused when he was trying to explain the guidance in the lockdown of the northeast of England and had to apologise for misspeaking. So all of these things erode public trust. What you also should not do, and unfortunately the UK government is doing this, is you should never blame the public in emergencies. On one level, I would say it's wrong because it is clear, for example, in this current pandemic, that the British public has behaved much, much better than the authorities thought they would. But if you then start blaming the public when things go wrong, that erodes public trust further. And a recent poll that was done last week showed that there is much higher public support for the current restrictions than a lot of politicians actually believe there is. So 78% of the UK population support the new lockdown measures, so long as they're clear and consistent. We have a problem in the UK as well, is that young people have often been demonised for not following the restrictions, and we currently have lots of UK universities where the students are in lockdown. And the problem with demonising young people and saying, oh, it's all their fault because they're going out and getting drunk and going to parties, it's not entirely true because not all young people are doing that, but also it risks creating a self-fulfilling prophecy, and it risks demonising the young people into a different psychological group. So if you show, again, media footage of young people going out partying, other young people who are obeying the restrictions and staying at home might see that and think, oh, well, why shouldn't I do that as well? So it's very, very risky to start blaming the public. Okay, so to finish, my last couple of slides, I'm going to give a couple examples of what I think are bad leadership and good leadership. So it may not come as a surprise that the UK's leadership has largely been criticised for not listening to the scientific advice and behaving in a way that's not good for encouraging public trust or public compliance. So Boris Johnson's recent press conferences have adopted quite a coercive approach. So you can see in the picture I've got up there, he's clenching his fist. The way that he presents, he tries to come across as Churchillian. I've spoken to the media and said he almost sounds like a headmaster talking to naughty school children, emphasising the people that breach it and the rules and the sanctions they're going to have against people breaching the rules. This is a problem because there are nowhere near enough police in the UK to properly enforce the measures. The police don't want to do it anyway. They're more than busy with doing other things related to the COVID pandemic, and it's also counterproductive. What we need is a more facilitated approach to get people to obey the restrictions because they think that's the right thing to do and they want to do it, not because they're being coerced to do it and they will be punished if they don't. And Steve Reischer, who's a social psychologist based at St Andrews University in Scotland, has contrasted Boris Johnson's very coercive approach with Nicola Sturgeon, the First Minister of Scotland, who has a much more partnership-orientated approach, which tries to encourage facilitation with the public. Now, this leads on to an example of good leadership, which is the New Zealand Prime Minister, Jacinda Ardern. She's been widely praised for her actions during the COVID pandemic. She has a much less coercive approach. In her press conferences, she's much more empathic. She generally allows questions at the end of the press conferences and talks much more about taking collective responsibility for the crisis. So we all need to work together as New Zealanders to do this. And I would say that this is mapped by the fact that New Zealand has one of the world's lowest COVID infection rates in the world. And admittedly, they're an island in the South Pacific, so that's an advantage. But then the UK is an island as well, and that hasn't protected us. So they've got one of the lowest COVID infection rates in the world. And I would say that that's at least in part because Jacinda Ardern is showing very good leadership in encouraging the public to obey with and comply with the lockdown measures. Okay, so my final slide, which is take-home messages, and then we should have a couple of minutes for some questions. Irrationalist models of crowd behaviour are outdated and unsupported by current evidence, so panic models should not be used in emergency responses. The public do need to be trusted a lot more during the current pandemic. If you give the public clear, consistent messages about COVID, about the restrictions, and why they need to follow the restrictions, people are more likely to comply with them. The problem is, though, that if you encourage competitive behaviour, that's going to mean that people are less likely to comply. So that needs to be addressed by less sensationalist media reporting and ways that address the public by appealing to a more shared identity. So I will stop now. Thank you for listening, and please do get in touch with me at the email below if you have any questions.
Thank you very much, Chris, for very good presentation. The slides, I repeat that the presentation of Chris will be available on the website. In the meantime, Chris, I sent you a couple of questions asked from the audience. At the end, if there will be some time, maybe I will also be able to ask one question to you, but yeah, pick up a question and the floor is yours.
Okay, thank you. So I've just seen question one, do you have examples of other large-scale emergencies from your research that demonstrates the panic model does not apply? Yes. The research I've done, for example, into the 7/7 bombings showed that mass panic didn't happen. There's been an enormous amount of research into 9/11, and there's been research going back on mass emergencies all the way back to World War II and the bombing of civilian populations in the UK, Germany, and Japan, and the atomic bombing of Hiroshima and Nagasaki. And pretty much all of them have found that mass panic just did not happen.
Okay. And now, if you will allow me, I have a question. So with regards to the clear communication, are there any communication means that have proved to be more impactful in terms of human psychology? For instance, is TV better than written communication, or a combination of both is more efficient? What is your opinion on this?
I would say it's the important thing is considering the psychological relationship. Human voices are better in fire alarms than just noises, but generally the medium that you use, if it's social media, if it's words, if it's radio, it's TV, the crucial thing to consider is what does the relationship the audience have with the message. So it really, really varies, and I would say that all forms of communication can have a role, but the crucial thing is not just the content of the message, it's the relationship between the source that gives the message and the source that receives the message, and you have to consider that as well.
Okay, that's clear enough. Thank you very much. But do you see the way we deal with emergencies changing based on this new research, or the panic model continues to be used, in your opinion?
Well, since I've been doing this research for the last 15 or so years, the authorities that I spoke to are generally moving away from the panic model. They certainly in the UK, they have realised that having the panic model can be counterproductive. So, for example, it's fairly now well accepted that the Hillsborough football disaster that happened in 1990 was largely as a result of having a particular view of crowds at the time that would not be held now by the emergency services. So I think things are moving in the right direction, but the problem with the panic model is it's very, very deeply held. I mean, even in public discourse, every time that there's a mass emergency or an incident, if you look at media footage of it, I can guarantee that words panic and stampede will be used in any crowd disaster. So we do need, as a society, to kind of overcome our view of the panic model. But the emergency services I've found in the UK are actually moving in the right direction. And a lot of the people I work with in the emergency services now do understand that they shouldn't use the panic model in their planning and emergency response.
Okay, I know you have to run because you have a class to teach, so I don't want to take most of your time, but I'm very, very grateful for your contribution and your presentation, and I wish you all the best, and thank you very much for this interesting discussion and questions answered. Thank you very much, Chris.
Okay, you're welcome. Bye.
Bye, Chris. So now we are moving to a second speaker of today's webinar. David, the floor is yours.
Well, thank you and good afternoon, and thank you to Chris for that really interesting, insightful presentation. We will be picking up some of the same themes that Chris has mentioned, but doing so in a slightly different context. The research that I've undertaken over the last 11 years has been with regard to dwelling fires. So events that are much more regular and smaller in scale, and they tend to go unreported in many ways. But actually some of this, the human behaviour and decision making, that is absolutely key. So there's a couple of things that I think are really important to understand, and it emphasises the point made by Chris. Traditionally, we see the public as a problem, and we need to move that away and see them actually as an asset. And we're also at a point in time where the world around us is changing much more quickly than it has done before. There are opportunities around technology, there are different threats. And I think one of the things I hope to present is we're at a point where we need to really look at how we operate and make some transformations in the way that we're seeing in other sectors to make sure that we're future-proof. And the research that we've undertaken suggests some areas where that's the case, and I'll run through those in a minute. But it's very much based on a UK perspective of dwelling fire research, although some of the learning and many of the principles will be transferable. What's different for us is we took a very hard look at the evidence and also came at it from a customer perspective, so from a human perspective. In the UK, like many countries, we're fortunate to have a professional emergency services. What's interesting about that here, though, was when we looked at how that relates to the role of the public. And what we expect of the public, in many terms, is passive compliance. To trust that we've done all the working out for them, that the evidence is strong. And so all they have to do, they have no decisions to make when encountering a house fire. They just have to follow the guidance given. What's interesting is we see that in terms of the public messaging, looking like some of the things that we can see on the screen. It emphasises the dangers and the risks. So it's don't take any risks. There is no such thing as a safe fire. Fire kills. At the other side, it also emphasises we do not expect anything of the public. Just get out. Leave it to the professionals. Do not stop to collect personal belongings. It portrays a very, very dire situation, one in which the emergency is very real and immediate action is required to escape safely. Interestingly, though, these are long-standing messages and they don't actually influence public behaviour an awful lot. We'll discuss some of the reasons for that in a minute. Where they do have an influence was somewhere we hadn't expected. They tend to have an influence on people working within the fire service. And so it's interesting how your own messages can actually come back and have an unintended consequence. We ran some workshops for the staff in our emergency control room, and we divided them into two groups effectively, those that recently joined, those that have been with us a while. And we said to them, when you pick up a call to a house fire, tell us what you're expecting to be happening at the other end, and tell us why you believe that to be the case. And what we actually found was that those who joined recently had a much more accurate representation of what was likely to be happening than those that have been with us a while. And I think it's because most of these messages the public don't see very often. They don't believe a fire is going to happen to them, so they don't take much notice. So they kind of miss the point. But when you're in the service, you see these regularly. And if you're not going to fires, you don't know that most fires aren't these dramatic infernos, you start to believe this because it's around you all the time. So actually one of the things about the message is the place it has most effect was within the service itself. But as you can see, they're very direct, they're quite paternalistic, and they don't give the public any choice at all. It's not don't take unnecessary risks, it's don't take any risk. And there is no such thing as a safe fire. They are very stark and create the worst case scenario. So when we look at a fire, we used during our research a very simple tool for a lot of time about just a timeline. And as you can see on there, we've got a fire, we've got the call to the emergency services, the fire service arrive. As a fire service, what was interesting to us was not all of it, but particular parts. The fire's of interest because it tells us at the end of the incident what caused the fire and how much damage it did. So at the time, we won't take a lot of notice of those, but in retrospect, at the end of the incident, we would do. The 999 call, or the emergency call for colleagues in Europe, is of importance to us because it lets us know something's happening where we were needed. So in the UK, that's predominantly an audio call. It will be based on tell us what the problem is, where it is, and we will send the necessary resource. In this model, the response time is absolutely crucial because at the call, we are not doing anything to help. We have to get resources to the scene before we can actually make a meaningful intervention. But interestingly, in the last 25 years, that response time has increased for dwelling fires in the UK from about 5.5 minutes to 8 minutes. So by default with this particular model, the quicker you get resources to the scene is a really key measure. And all incidents are based on that we have to get to every incident quickly. So we're not interested in the risks or the particular nature of the incident, it's just we will get there as quickly as possible. One of my criticisms of this would be, is actually what that does, that metric means that we're focused on trying to improve that despite the fact that it hasn't been able to do so. And it's stopping us looking at other areas that are more important. Once the fire service arrived, they would obviously exclude most of the people from the scene, and then we would leave the public to deal with post-fire. Our research showed us the effects of a fire, even a small one, are much wider and much more long-lasting than we previously imagined. And they are very individual. They're hard to predict. They are very personal to that individual or the people affected. But the gaps in between about the human behaviour and what the public do, we aren't interested in. And here is one of the problems. Because we don't collect that information, it doesn't appear in academic literature, it doesn't appear in our routine data. So it's disregarded, it's invisible. And so we're ignoring the contribution of the public, but we're telling a lot about what we do. And that perpetuates this focus on purely professional response and not accepting or recognising the public for all of the things that they contribute and all the needs that they have. And that's something that I think we really have to start to address. It was in that context and that background, back in 2009, we asked a question. Increasingly at fires that we attended, the public weren't doing as we expected them to or told them to. That was important because for house fires, they represent a disproportionate risk. So although they account for about 15% of fires, they were actually responsible for about 60 to 70% of all injuries. The number of fires in total was going down, but when a fire occurred, you were just as likely to get injured, and that's been the case for many, many years. So we weren't improving people's chances once a fire occurred. So we wanted to understand why, what was going on, why do our messages not have influence? And I instigated and led a study at that point, which went on for a number of years. We started with a conference to understand what the current knowledge was. We did local studies, regional studies, and then ended up with a national study, during the course of which we spoke to between 1,000 and 2,000 people who had experienced a fire to understand, in their words, what that was like. And the findings were vast, and we could spend a long time discussing those. But for now, the summary here is the important part. Number 1 and 6 are particularly important to this debate. The role of the public. our relationship with them, and it's something Chris touched on as well in terms of being empathetic. Risks, tolerance and continuity. You'd seen in the earlier slide that there are gaps. Even once we become aware of an incident, we put the phone down on people until we arrive at the scene. So there are breaks in the risk management. And the risk tolerance relates to the fact that in public policy, most of our view is that the public want to avoid injury at all costs. It is the only thing that matters to them. And what we found was a much more wide range of outcomes that the people wanted, which result in things like wanting to avoid embarrassment to things they wanted to save. In doing that, most people were, even those that had minor injuries, would have done exactly the same again. They accepted a level of risk that came with that, which is completely at odds with the assumptions made in public policy. So we have a really fundamental difference there. The post-fire bit I've mentioned, and again, I'll touch on that later in the presentation, but there are some really important aspects to consider in terms of if we understand the harm and the impact fires do and other emergencies in the longer term, rather than just at the point that they occur. So how does this then relate to the real public experience? Again, using this simple timeline. What we find, rather than passive compliance, is periods of active and unsupported decision-making during a dynamic event and during one that people will be unfamiliar with and exhibit some distress. And I'll emphasize again the point made in the previous presentation. We found no evidence at all of panic. People may behave slightly differently, but they respond rationally and sensibly to the different environment they find themselves in. And that's a really important point in understanding how our relationship with the public should be. So when we first become aware of something's different, for about 2/3 of the people, it was from direct cues. They were aware of a fire because they smelt smoke, saw smoke, or they was in the room. They either then tackled the fire, they may decide to preserve valuable items, they may want to warn others, particularly in the cases where houses got multiple occupants, and the people, rescuing people and pets was one of the things that we really found we hadn't understood before. The influence of pets on people is really strong. So typically they were undertaken between 1 to 11 self-appointed tasks with an average of about 5, and the last but one thing they did, if they needed to, was call the fire service. And I say if they needed to, because again, what we hadn't realised is about 70 to 80% of all dwelling fires were dealt with by the public without ever calling for assistance, which was a huge number. And I think from some of the statistics I've seen, that's quite common in other countries as well. But even at this point, when they made the call, they then have a period of waiting. And again, important for call handling to think, when they described the activities undertook in the initial stages, they were very quick. So they said that whilst they was busy, that time really went quite quickly. As soon as they had to wait, they would describe a 5-minute wait as feeling like 20 minutes. And so the urge to do something becomes quite strong if you're not supporting them and not engaged with them. So that period between being aware of an incident and the resources arriving, actually quite a critical period. And what we found is 50% of injuries were being incurred after somebody had phoned the fire service for help. And again, once the fire service have arrived and then disappeared again, post-fire, there was a huge amount of decision-making and unfamiliarity. And it struck us, regardless of educational level or any other factors, most people really struggled with this. And things that, had they been better supported, would have been dealt with quite quickly. We were finding months and years later that people were struggling to come to terms with and get their lives back on track following a fire, much of which is avoidable. So the best outcome for people is not just that the fire's put out, but actually it's done in a way that reduces some of the other vulnerabilities and harm that they may experience. So the key findings we had from the research, the earliest intervention is the best one. Whilst it's not true that small fires have small consequences and impacts, in general, the smaller the fire, the better the outcome. There are some exceptions to that, but those are ones that, by and large, it is a true ruling. And again, emphasising the public are a willing, capable and effective asset. They deal already without support with the majority of the fires, often using improvised means rather than bespoke equipment. And so rather than working against human behaviour by trying to change it, we need to be better at working with it. These are well-established behaviours. They've been true for decades in the research, and they're also entirely understandable and rational. And from the customer experience side, if we understand that as a human experience, not as a process, not as a technical procedure, we will get much closer to the public. One of the things, whilst we may understand and look at our own service in terms of how well we complied with our procedures, one of the most important factors for members of the public is how we made them feel. And that drives a lot of the customer experience market in the commercial world. How we treat people really matters. It's what they remember. And also how they're treated at the end, which comes back to the point about leaving people on their own. Doesn't matter how well we've done up to that point, if we leave people at that point at the end unsupported and just drive away, their impression of us can actually be quite negative. And I think, again, one of these really crucial parts is there is insufficient and very partial use of evidence and risk management. We've got used over the years to work in a certain way, and we add to it. By stepping back and really looking at what we know and what we assume, it starts to look different. One of the things that really struck us during the research is, during my career, I'd always been taught that children hide under beds and in cupboards. And so if we turned up to search a house with just two of us, we had to search thoroughly in every room to make sure that we didn't miss anyone. When we tried to find the source of that, we couldn't find any studies that confirmed it to be true. Our hunch is that it came as a result from investigations into fatal fires, where that may have been the place that, sadly, those that didn't make it were found. That's not necessarily to say that's what they were doing before that point. And a colleague undertook some research, and they did a systematic review of all the English language studies across the world, and could not find any in which children who'd survived fires were the primary focus of the research. So in truth, we understand absolutely nothing about what children do in fires. So when I'm searching, I don't know whether I have to search every room thoroughly or whether we need to get around the house quickly because they'll be visible. So these things really matter, but that is something that went all through my career, that teaching and guidance, and it becomes true because we repeat it so often. So whether it's a private dwelling house, whether it's a cinema, school, or any other public building, there is nothing that tells us about children's behaviour. And obviously there's a range of that, from very young to teenage, and the influence that children have on other people around them who have care for them. So what does that mean? In trying to piece this together and trying to deal with some of the opportunities and some of the current flaws, we propose a different approach, one at which we particularly look to manage and resolve the incident at the earliest intervention. In this case, we know very little about the public and the 70 to 80% of fires that they deal with. They don't call us, they're not visible to us. But that is the best opportunity. So one of the proposals is that in that we need to be better at looking at what the public need, what advice do they need, what equipment do they need. Crucially, how do we help them understand the point at which, or the type of fire they will be unable to deal with, and they should be calling for assistance. At the moment, they have to do all of that on their own because we will not help them to interpret risk. We just keep repeating the same thing, get out. But if we can help them at an early stage, the likelihood is most fires will be dealt with. And if they weren't dealt with, if they followed our advice just to get out, we would see an increase in demand of 4 to 5 times, which we could not deal with. So we have to recognise the contribution they make and our reliance on them. And it's similar in some ways to the external defibrillators that are now community-based, because time matters. So that's the first point of assistance, and then support arrives beyond that. In the event that the public can't deal with it, we can look at the second intervention. Here, the proposal is that we provide remote assistance. It's not just a case of we're on our way. Contact is maintained until the physical arrival. If that is required, it may be that by providing useful advice remotely, that the incident can be resolved without that. At the moment, again, we need to think about what's that like for the user, and probably audio is no longer appropriate for that because we want to engage them, we want to understand what's important to them. And that's one of the key things, that in each fire is individual. If at this point we understand that somebody's major concern is their pet and its well-being, That's important for us to know, because all of their behaviour, their thinking will be driven by that. And if we don't recognise it, we will not manage to communicate effectively with them. It's also important that we can tell the crews when they arrive this information, because for the person who's experiencing the fire, they may have already accepted their building's damaged or lost. But if you can save the pet, that would still be a good outcome. And we have to understand fires in this individual way. And this period of time at the moment is lost. We're also not using that effectively to learn, and I'll talk about that in just a moment. The second part I put there is about incident management, and I won't dwell on it too long at the moment. But again, we have this break that we're not using. Because we just want to be alerted to the fire, if somebody else phones to tell us about to repeat the call, we will tell them we're aware and on the way and lose the call. I think there is more that we can be doing now to say, actually, if we use this to establish communications with as many people as at property, particularly high rise or complex buildings, by the time the crew arrive, we may know the whereabouts of half the people. We may be in direct contact with them, and it makes the incident quicker and it makes the crew's job easier. So if we think about pushing forward when we can manage the incident to the emergency call rather than physical arrival, we would be giving ourselves an extra 5 or 20 or even more minutes to start that process, to mean that the earliest intervention is even more effective. In the third intervention, that is very similar to what we see now. I'm not going to dwell on that particularly. I've put there as a fourth intervention, support recovery. In many commercial centres now, that remote support through contact centres, particularly during COVID crisis, has really expanded. They have become very accessible. They can provide a range of self-serve or specialist support. And I think if we want to help people recover from the fire, reduce the harm, make it a lot easier, there is a potential role to be able to link that back into providing remote assistance and support them back to recovery. But I'd like to take a chance to say, from the very start of the work that we've undertaken, the emergency call has represented the best opportunity to innovate and significantly improve the outcome and experience for the publics. And I think it's also probably one of the most future-proof resources that we can start to develop if we can reimagine it in a slightly different way, both for what the public need of us as well as what we need of them, and with some of the principles that I've outlined here. It's the first place in the model where the public and the fire service engage. Prior to that, the public are on their own. When the fire service arrive, we will tend to exclude them. But we have this opportunity in the middle where the public are on the ground. We know that they don't panic. We know they're very capable and effective, and we have the expertise remotely. We need to do more to join that up. It's also, for me, the place where the technology and customer experience model have the best opportunity to work together. When calls are taken at the moment, we lose and waste a lot of data. Every call represents a chance to learn something about a dynamic phase of an incident. If we were to start to collect that in a way that artificial intelligence and machine learning allows us to, we would build up some profiles. We would start to know the risks of particular groups, and they can provide prompts to the caller. They not dictate to the caller, but just a range of behaviour to say, this is typically what this person may experience or the risks that they may face. We would have a much more intelligence-led approach. And again, what we've seen in healthcare is where this automation starts to take place, the lessons are picked up very quickly, and that's shared globally through a network immediately. Like many sectors, the emergency response sector struggles sometimes to identify, learn, and share lessons. If we start to look ahead, some of the technology will allow us to do this in real time. And I think the great opportunity for that is within the emergency call handling. But we have to deal with some of the assumptions we have about the public, and we have to build from an evidence-based and understand our relationship with the public and make that work. Certainly, future challenges are going to be more complex, and we need systems that will be flexible, as we've seen during, again, the COVID crisis. And I think also what we're not doing so well at the moment is learning from the everyday incidents to inform our ability to prepare for and respond to larger incidents. And again, if we think about that post-fire support, what resources are people drawing upon to recover? What resilience is in there? Because actually, if we understood that better, it becomes very important, particularly at mass events. And we had a good example where rather than we had a large fire that made about 60 people homeless, rather than saying purely that we were in attendance and working very hard, which was the case, we explained the difficulty that we had with these people, and it was late at night. And because we made it a problem that the public could relate to, we had all sorts of offers come in, people offering to share accommodation, shops offering to open, the vets opening to take pets that needed home for the night. It was something that the community could respond to. And again, I think we've seen that with the current pandemic crisis, that if we provide a way for the public to help, they're willing to. They are our partners, and we should use them in that respect. So just drawing to a close now, increasingly we have to look at the evidence and recognise that the public are actually part of our team. They're an asset that we're not using, and we're doing them a disjustice by not recognising the contribution they make. We have to recognise their needs, and in doing that, we can help keep them safer to do the things that they want to do. We can help them understand when a real risk is present. The dramatic images we started with, messages we started with, are not true for very many people. Most people in fires are at most likely to get a minor injury. The majority of people have no injuries at all. Those that are likely to get to die in a fire are a very small group, and they have particular characteristics which mean they can't respond to a fire. So that dramatic messaging, whilst it may be good for social media and things, it actually distorts the truth, and it doesn't help us have a reliable communication. But if we can unpick some of these assumptions, if we can make our messaging more objective and relevant, we can start to imagine different ways to engage the public. We won't spend so much time and effort on things that aren't of themselves going to make a difference. It's not to say things like response times aren't important. They are, but not when they're distracting us from other opportunities. And I believe the evidence is starting to show us many other opportunities to bring down injury rates, to reduce the harm from the fires. Last year, we published a report, which you can see there, Saving Lives is Not Enough. We applied a similar process to what I've described in this presentation to look at the burn survivors' journey. So when somebody incurs a burn in a fire, what does that look like? And what we found was they're the only one that see end to end. All of us at different organisations did different bits along the way. And it looks very different to them. If you're interested in reading the report and our recommendations, you can see the link there. And I hope that's been of interest to you. And if there's any questions, I'm happy to take those. Or if not, you're very welcome to contact me afterwards via the link, email or LinkedIn that you can see on the screen.
Thank you very much, David. I have some questions, but first, maybe some questions from the audience. I will also put them publicly in the audience channel, so you will see. Please feel free to answer, and yeah, have a second to read them through. Yeah.
Okay. Yes, there's a question here which asks, for the emergency call, do I think that for the customer experience, multimedia could be useful, for instance, video or photos? And the answer is absolutely yes. In the UK, we've started to see 1 or 2 services experiment with video, but they've done so in order primarily to improve their ability to deploy the right resources. And again, there's no criticism of that. It's perfectly sensible. Not all incidents are as described. But I think from the customer experience side, we have people in a distressed state. And the more we can consider what their needs are at that time, we go to work expecting these events. We put on the uniform, we've got colleagues, we've got training, we've got equipment around us to support. For the members of the public, this comes unexpected. It disrupts everything they were doing at that time. And when we've gone away, they're left with the consequences long after. And I think the more we can make us human, the better. I mentioned the workshops that we did earlier, and they were fascinating insights into how we train some of our personnel, and even when they know that the contact they have could be better, they have to follow the script we've given. And I think, yes, absolutely, videos and photos, there is so much scope to do that, to improve what we do. But more importantly, I think from my side, to reduce the distress and improve the experience for members of the public who are having a really bad day when they contact us.
Okay, I'm just having a very interesting question here. If I can, David, what recommendations do you have for emergency services organizations to help the public identify risks and be resilient? Example, should this involve outreach programs or education in schools, or what would be the best methods in your opinion?
That's a really good question. And I think there is a level at which we should always educate at school to develop an awareness, but it has to be sensible, it has to be realistic. We looked at the messaging around what should people do when they're having a fire, and of course the advantage people have, or teams like about get out, stay out, is it's just very simple. You apply it to everything, and I appreciate that. It's a simple message that can be conveyed, but I think we need to. Very few people will experience a fire, fortunately, and if they've had that message a year before, does it mean they're likely to remember it? The evidence would suggest not. So I think from my perspective, in dealing with incidents, I would like to see us move to a model where we say, just phone us and we will help you. But that can't be on the current basis of where we just tell people what we want them to do. And I think if we did that, we would actually see people calling us earlier. I mentioned that it's the second to last activity that people do. If people called us earlier and we were happy that some people will deal with incidents without us, some people with us, then actually I think more people would contact us and we could help them in the moment. And if somebody, because of their individual circumstances or the nature of the fire, is genuinely at risk, we can give them credible advice to that effect. So I think it's a really good question, and it may differ in different countries. I support education in schools. I think that's a really useful time. But in terms of emergencies, I think trying to educate the majority of people is really cost ineffective, because most people are capable of dealing with fires. We've seen that from the evidence, and to try and educate them all constantly, we won't get the message through. Be useful when we're needed, I think, is a much better approach.
Okay, still up for one last question, David?
Go on, of course.
Yeah, okay. So do you see that procedures are starting to change in emergency call handling to take more into consideration human behavior and the customer experience perspective, or we are just at the beginning of this change? So if you will just explain us this, and then what are the next steps for your research in this area?
Okay, I think in terms of customer experience, we are very much at the start. The good thing is, if we're prepared to look at it, we all have experience of what that looks like. We all know the companies that are very easy to deal with, the ones that we like dealing with, and some of the things that they do, they reduce the effort that's involved, they make it very easy to give feedback, they're very contactable. Those principles are well established. I think the more challenging one for emergency services, and it's detailed in the Saving Lives is Not Enough report, is we've got to be much better at joining up the service. As somebody who calls upon the service and goes through different agencies, everyone has different priorities, they have different language, they have different processes, and it's a very, very disjointed experience that the member of the public has. And so we need to find different ways to work in partnership, and that will be challenging. We have some thoughts on it in the lessons learned section in there. But so I think, like most companies that in the commercial world, customer experience isn't something you do once. Once you believe in it, once you commit to it, it's an ongoing process. But the difficulty I think we have at the moment is, in truth, we aren't very close to understanding what our customers need. The more I was fortunate, and what completely changed my thinking, for 20 years, I was a fire officer and firefighter, and I knew my job as a professional. It was only when I sat down with members of the public and heard their story in their words that I finally understood their experience was completely different to mine. from that moment, everything else became quite obvious. But I actually could have gone through my whole career and never spoke to a member of the public in that way. So I think there's more to be done, certainly. Once services are ready to go that way, there's a lot we can do quite quickly. In terms of research, I've been looking actually at the role of a fire extinguisher recently is one area. Again, it's quite interesting how assumptions influence that. But some of the other research we're looking at is really around emergency call handling, and how can we look at that afresh from using the research in different perspectives to perhaps reimagine what that could look like. But for me, as I say, it's the most exciting opportunity to really improve experience and outcomes for people that experience emergency.
Okay, well, to be honest with you now, it's really the most interesting part of the webinar, because I see that the audience is really moving in a good direction. They're asking questions. So please hold with us still for a while, David, because I still have some questions coming to you. It's not a problem if we take more of your time right now. I mean, I have a couple of more questions. Maybe you can be more, short in answering, but it would be good to actually answer them. Okay?
Of course, very happy to do so.
Okay, so the question is, how do you see the role of control and the crew responding during the intervention, working to improve the experience and the outcome for the customer?
Okay, I think, as I say, very much I would see that changing in terms of the technology and how we imagine that. But I think it's a more human role. And again, I can give an analogy from commercial sector. You start to remove some of the routine process. And in many organizations, that creates a fear of they're going to replace jobs. The smart companies haven't done that. What they've done is they've released their staff to be much more helpful and effectively upskilled them. It becomes a more technical role. And I think if you go back, if you can recall my slide about incident management starting at the call and starting to engage with the public in a different way before crews arrive, or maybe if crews aren't even needed, you will start to get some insights into how that role changes. And I think, as I say, it's slightly different skills we have now, but it's going to be much more intelligence-led. It's going to be much more empathetic. And I think my sense is it'll be much more rewarding because you will directly have that connection with people that you'll be able to help. There are some bits to work around. There are some caveats around that, particularly for some distressing incidents. Obviously, there may be some that we don't necessarily want live incident feeds to, but I don't think that should be a barrier. Those are things we could work through. But I think it becomes a much more diverse role and a much more skilled role. And that's certainly not in any way to say it's not a skilled role now, because, as I say, the utmost respect. And I think it's always been from the start of the work, the area where there's most opportunity.
Okay. Oof, questions are flowing. The time is running. I will definitely allow one more question, and afterwards we will stop the webinar, which was supposed to be 1 hour, but I think that if the conversation continues, that's a good sign. So here I send you 2 questions. Please feel free to read them a little bit, David, and choose one to answer. I personally think that maybe the second one is more interesting, but it's up to you to choose. And when you're going to be answering this question, please read it maybe first out loud.
Would this be the one relating to legal side? Is that the one you're suggesting?
I think so.
Okay. So the question is, if we aid the public in helping themselves, where do you think the legal side is when they injure themselves more? How do you approach this? Furthermore, time per caller is dropping due to less staffing. How do you suggest to approach these ideas? I'll deal with the second part of that quickly. In my previous service in Kent, we had a similar concern. So some people were saying we haven't got enough time for this. But actually what we found is we had approximately 2 dwelling fires per day and an average response time of 7.5 minutes. So we only needed to find 15 minutes per day to be able to bring this service in, where we would hold a caller on the line and till the crews arrived. So in truth, it wasn't that bad. There are ways to obviously take out some of the other tasks. So messages about status for officers or appliances, whether they're mobile or that, can be done automated. So if we change the way we think and what we're trying to achieve, there are ways to take out other tasks that allow time for this, which is quite small. The legal one's really interesting because in truth, I think it's the bit that most people are put off by. And I've had this from senior officers that they are concerned that if they gave advice to the member of the public and they got injured, they would be sued. I think in some ways you could argue the opposite. I'm not aware of any cases where that's happened, and certainly if you look at health, they are every day giving out life-saving advice and life-saving interventions by phone remotely every day. There's not a lot of people getting sued. So I think it's not insurmountable, but it seems to some people be enough to stop any further discussion. But the risk aversion of individuals and organisations in taking a step is actually quite key. If we look at the evidence, most people are getting very minor injuries. We as a professional service know how to keep people safe to use extinguishers or fight fires or to decide when to get out, and we refuse to give that to the public. I would be more concerned that somebody finally twigs that and sues us for withholding information in the majority of cases. So I'm not downplaying the legal side, it's a concern, but it's not a blockage. Again, it's just something we work through, and it's something I've heard a lot, and it does tend to be the thing that almost stops any further progress. And I think the evidence is so compelling about why we need to change that legal advice or legal concerns are not something that should prevent us taking that route.
Okay. Clear enough. I hope that the person who asked the questions are happy with the answer. Feel free to ask more, David, because he provided his contact details on his last slide. And with this, I am happy to thank again our speakers today for their time, preparation, great presentations. The recording and the presentations will be available on the webinar website as of tomorrow. So feel free to consult again the materials of today. I take a little bit more of your time to announce the upcoming webinars that we EENA will have. So the first one is on the 8th of October, and it will be on mental health and emergency services at 4 o'clock Brussels time. So in fact, we organized this webinar to celebrate the World Mental Health Day, which is on the 10th of October, to raise the awareness of the importance of mental health in emergency services. If you are interested in non-emergency numbers, this is the topic of our second webinar in October, 21st of October. For more info, dig into the website webinars page, where you have always new webinars coming up, and the info is updated there regularly. If you can always reach to us if you have any suggestions or recommendations, or questions after the webinar. We are there, so feel free to contact us as well. And with this, I am happily announcing that the webinar now is officially over. Thank you very much all for participating. Thank you again for the speakers, and looking forward to welcome you to another webinar. Have a great afternoon, everyone, and take care in those challenging times. Bye-bye.